Great. Well, welcome everyone to Philanthropy Network COVID-19 Funder Briefing. Really excited to hear from the guests we have with us today. I am Sydney Hargrove, and at this time, please place yourselves on mute. This session, please also remember that this session is being recorded and will be available on our website at www.philanthropynetwork.org. The purpose of the call is simple. We try to share information and updates regarding the ongoing COVID-19 pandemic response and issues that we're seeing throughout the greater Philadelphia area. And so we have, different speakers each time to come and share from their perspective. And this morning, we're going to start off a little different. We're going to have a brief video, very brief, from now I'm actually not going to say anything about it. I'm just going to share it and then we'll move on. Share it. So that was Dancing in the Streets after the work of the Black Doctors Consortium, which is one of the speakers that groups that we've had on to share with us periodically. And just really thought that it embodies, how so much of how, we're all working to address the issues, but that, we're seeing regarding the pandemic, but also at the same time trying to find ways to encourage each other along the way. So wanted to start with that, but we will begin now with our speakers. We're happy to have with us today and Torregrossa, Executive Director of the Pennsylvania Health Funders Collaborative, who will give us a view of what's going on related to COVID-19 in the state. Ann?
Thank you. Well, it's really great to be here. I don't know, it's a tough act to follow Dancing in the Street, but I'll try to do it. Let's see, slideshow. As Sydney said, I'm with the Pennsylvania Health Funders Collaborative, and let me tell you a little bit about who we are. We're 13 years old and we're nonpartisan. We work with both Republicans and Democrats and independents. We have about 40 health foundations pretty much across the Commonwealth. Many of them are hospital conversion foundations. And the purpose of our organization is to network and learn from each other, but also to advance efforts to enhance vulnerable populations' access to high-quality, cost-effective health services. I was with the Rendell administration, and they recruited me to work with this organization to work with the health policies on vulnerable populations. We have been working a lot on COVID. When this all began, we had no idea what the devastating impact of this virus would be. And I think as was the case with all of you, we first became aware with reports of deaths in Washington State's nursing facilities. And that should have been a wake-up call for us, but it wasn't. And then as COVID began to appear in Pennsylvania, we became alarmed with reports of increasing deaths in Pennsylvania's long-term care facilities. Right off the bat, we saw that there was a problem. You really can't do very much about a disease like this if you don't test, find out who's infected, and quarantine them. And Pennsylvania had, at the beginning, very few testing resources, as was the case of other states. So they followed the Department of Health's, the Department of Health followed the CDC guidance to only test people with clear COVID symptoms. And the problem, of course, is that about 50% of people who are infected with the virus are asymptomatic. And so if you have 50% of the people who are infected walking around not realizing that they have it and they don't have symptoms and you're not testing them, you've got a real problem. And the problem for long-term care facilities was two-part. One, they had lower income staff who were more likely to be exposed because they lived in situations with intergenerational. They used public transportation. They were young and often asymptomatic. They also often were not paid when they were ill, so they would come to work. The other problem, of course, was the residents in long-term care facilities have multiple chronic conditions, are older, and are the most vulnerable to infection. So long-term care facilities were really the perfect petri dish for COVID transmission. Deaths in long-term care facilities in Pennsylvania really took off in April and May, and represented far more than half of the deaths in our state, despite their people being only 5% of the population. And despite our best efforts, the Department of Health refused to change the testing policy. We really advocated for this, met often with the governor's office. We advocated for testing of all staff and residents, testing of patients before they were discharged from hospitals and admitted to long-term care facilities. We advocated for SWAT teams of hospital staff to provide PPE, gloves, and testing and help long-term care facilities with infection control because they were really out of their league. Poor Allison Bean, who is now the acting Department of Health secretary, we nagged her constantly. We were on the phone and on Zoom with her, talking to her about the death counts, what other states were doing that were far more progressive than Pennsylvania. And finally, on May 11th, we had a minor breakthrough when the Trump administration recommended testing of all long-term care staff and residents, and we began to see a change by the Wolf administration. At that point, in 8 days, we had 1,025 deaths in long-term care facilities. In the county I lived in, 70% of the deaths were in Delaware County, were long-term care facilities. So when we finally did get testing of all staff and residents, what did it show? Well, there are two sources of data. One, the Department of Health summary data, and then CMS required long-term care facilities to report infections and deaths of staff and residents. As of March 23rd, the last date that Department of Health has data up on the web, by facility, 21,536 long-term care staff tested positive. One facility alone had 211 infected staff. Can you imagine? And 131 nursing facilities reported no data, so it could be much higher than that. And neither CMS nor DOH has taken action about getting these 131 facilities to report data. In the summary data that Department of Health reports, they said only 14,231 staff tested positive. So there's a real disconnect between what the facilities are reporting and what the state is reporting. Almost 70,000 residents tested positive, and 12,912 have died according to Department of Health summary data. So long-term care deaths to date are 52% of the total deaths in the state, despite being such a small portion of the population, and that's just terrible. Things are better now. Pennsylvania eventually tested all staff and residents. They prioritized long-term care facilities, recognizing that everyone needed to be tested, given the asymptomatic rates and the fact that it really is a petri dish for COVID. Hospitals now test people prior to discharge to long-term care facilities. Large hospital systems were paid to help long-term care facilities with equipment, personal equipment, equipment, training, testing, and infection control. And the thing that really has helped turn it around was the federal vaccination program for all residents and staff. The worry is that the staff take-up has not been great. It's a little over 50%. The federal vaccinators, paid vaccinators, only visit 3 times. And so there's people that are entering long-term care facilities now who are not coming from a hospital are not being tested. Happily, CMS has given guidance to allow nursing facilities to open up for visitors, and that you can imagine the difference that has made in the quality of life for the residents there to be able to see family members. So infection and death rates have dramatically decreased in long-term care facilities, and if there is a lesson to all of us, this vaccine is dramatically reducing deaths and illness with this very vulnerable population, and we all need it. It's really working. Next, let's talk about contact tracing. We were finally beginning to get tests of Pennsylvania, but results were coming back in 1 to 2 weeks later. And of course, that's absolutely worthless. By then, your quarantine period may be over. You've probably affected another 20 people. So we have to really do something about our capability for testing in the future. If you got timely results back, you needed the infected person to quarantine and to cooperate with you about who they've been near enough to infect. And we really didn't have an adequate process for this either. We needed sufficient numbers of trained contact tracers to reach these potentially infected people. We didn't really have a good process, and few people would answer phone calls of people they didn't know. So we tried to work with administration to demonstrate to them that this was an inadequate situation. They didn't have enough contact tracers, and that regional call centers were not optimum, that people would respond to people they knew, trusted sources, but not to 800 numbers. People were not answering the calls, and often if you did reach them, they wouldn't cooperate. So just give you some idea about contact tracing in numbers. The average infected person will infect about 5.5 people. That's with the original virus. Now with these variants, it's even more people. So to be effective, you need to reach at least 80% of those exposed and have them self-quarantine. So yesterday, Pennsylvania had 5,374 new infections. You multiply that by 5.5, you get almost 30,000 possible people who were infected by the people who tested positive yesterday. And to reach 80% of them, you would need 23,647 to be reached and to agree to be quarantined. So when infections are large, as they are beginning to be now, contact tracing becomes almost impossible, and you lose complete control over containment efforts. So our Pennsylvania Health Funders Collaborative present priority is to get the state to modernize their public health infrastructure. Public health should be able to contain contagious diseases. We have over 1 million people in Pennsylvania who are infected. This virus is not behind us, and we will have future potential pandemics. Our public health system is not working. It should also help us to avoid death from communicable diseases. Our public health system is not working, and we should be screaming for change. Happily, the American Rescue Act is a once-in-a-lifetime infusion of federal funds that would allow us to address COVID and dramatically improve our state and public health infrastructure so it finally works for us. And I think if you wonder about the importance of public health, you only have to look at Taiwan. They have almost twice the population of Pennsylvania, and they only had 8 deaths. They didn't have to shut down their businesses. They didn't have to shut down their schools. So our state and local public health system is woefully inadequate. We have one terribly underfunded state health department. We have 10 local health departments. Philadelphia has one of the biggest, and of course, Allegheny County. 57 counties are without any disease and prevention help. And we have the 44th lowest state funding in the United States, $14.50 per capita. And if you look at other states, we're one of the white states. If you look at like California, New York, they're at over $50 per capita. You look at Utah and some of the lighter blue states, they're $40 to $49 per capita. We are woefully underfunding our public health system. So our present public health infrastructure really puts our economy and our educational system at work. If you think of what this pandemic has done to us, think of the deaths, the hospitalizations, people on ventilators, people in comas, the long haulers who are still suffering from this disease, the disabilities that some people will have for the rest of their life from this virus. You think of the businesses that are shut down, the jobs that have been lost, the bankruptcies. I'm so worried about future homelessness from these eviction moratoriums, which will end at some point, and evictions will happen. The disruption to our children, our grandchildren's education, the loss of time with children and grandchildren and friends. We get absolutely outraged over lone shooters going in supermarkets and shooting 8 people. We get outraged when police shoot unarmed people, and rightfully so. But we've not had the same outrage and the same call for change as we've had for the loss of over 25,000 of our fellow residents in Pennsylvania. We have to be more ready to fight this virus and the next pandemic, and I hope you will all join the Pennsylvania Health Funders Collaborative in asking our state legislators and the Wolf administration to do so. I think the Biden administration is really making an effort, and I think we will see some important changes at the federal level, but I'm not seeing the same action at the state level. Thank you.
Thanks, Ann. I have one question, and if there are other questions, we could probably take one or two before we go to the next speaker. So I read that nationally that was like 50% of seasoned citizens are vaccinated at this point. Is that true? And then what does that look like in the state of Pennsylvania?
We're making good progress in Pennsylvania. I think about a week ago, they said that over half of the 1As were vaccinated. They're talking about moving to 1B. There's still a lot of people that are vaccine resistors, and that's a worry. There's been a lot of difficulty by older Pennsylvanians who are not really savvy about trying to find these multiple ways of getting vaccines to do it. It's been an unbelievable hassle. It's not been, it again just shows the need for a comprehensive system that works for people, and it has not worked. I'm not sure we're quite up to 50% nationally, but I think in the next couple of weeks we will. It's really been a historical effort to get us there, and given what the vaccine has been able to turn around in nursing facilities, it really makes me hopeful that if we can avoid future infections and minimize them, that we can really all have a much better summer and avoid deaths and begin to get our economy and educational system back.
Great. Any questions? You can place it in the chat, maybe again, one or two quick questions, and then we'll move to the next speaker. Give that a moment, see. All right. Well, thank you. Thank you, Anne. Again, we certainly would like to be able to even ask you back a little later on and continue to follow the progress. But also thank you for just all of your information, and we'll make sure that everyone gets your information as well in case they have questions for you.
Great. Thank you.
Great. So next up, we have with us Denise Brown and Melissa Hamilton with Leeway Foundation to tell us a little about the WOO Community Care Fund for 2021.
Oh,
Who's
okay.
starting, Denise?
I'm going to start.
All right. Love your glasses, by the way.
Thank you. I love your pillow. Is that Bisa Butler? No, but anyway, I digress. Good morning, everyone. I am going to sort of give a slight overview of the origins of the Community Care Fund, and then Melissa is going to provide more specifics about sort of what we've distributed and sort of responses to the fund. So, we have to think back a year ago when we all thought we were going home for a couple of weeks and that things would settle down. And almost immediately we started hearing from grantees and others in the community about loss of work because many of the artists and cultural producers that we support earn their income from pre-booked gigs, work, sort of presentations on college campuses and so on. And a lot of folks sort of supplement income through being teaching artists and that sort of thing. So almost immediately we started hearing from folks about, losing anywhere from hundreds to tens of thousands of dollars. And as, we started to realize that this was going to be a longer term staying in place order, we started thinking about what we might be able to do to support members of our constituency who were being hardest hit. So we had a conversation on staff about the possibility of using the mechanism that we have in place for what's called the Window of Opportunity Grant, which is a completely online process. We thought we could move a portion of the money that had been allocated, or the majority of the money that had been allocated for the WOO grants, which are for time-specific opportunities, towards this idea of COVID relief, and had a conversation with the board, as well as the folks who had agreed to be the panelists. We impanel a group of 3 folks to review those WOO applications every year. And so we needed to get buy-in from them as well, because we didn't have any idea of what the volume would be. And traditionally the volume for the WOO grant is, anywhere from 2 to 5 grants a month. We also paid a lot of attention to the kinds of mutual aid funds that were popping up around the country. And Seattle actually sort of set the tone for a lot of what we were seeing. These were funds that were popping up, folks who were part of these communities were starting to solicit donations and trying to figure out ways to move money to people as quickly as possible. And in the case of Seattle, they started to receive support from, public funders and private funders, and were really able to get a lot of money out there. So through the hard work of the staff of Leeway, and again, you have to remember we're a fairly small staff, there are 5 of us, people started working, Melissa started putting together a set of guidelines, folks in communications started working on sort of the application, and sort of how we were going to communicate about this. And we also received news that we had been nominated to apply for a grant from the Sundance Institute, who had put together something they were calling the COVID-19 Respond and Reimagine grant, and they were particularly interested in supporting BIPOC folks. And so we received a grant from them of $20,000. And then we also got a small grant from the Certain Foundation of $10,000. And we had just received a program support from the Independence Media Foundation. And after a conversation with them, received approval to be able to shift some of the money from that grant towards the relief fund. So we announced the WU Relief Fund on April 12th of last year, opened the applications on the 15th, and put out the first round of payments on the 30th. I think I can freely speak for the staff, and Melissa can sort of say how she feels about this, but I think this is something we're all very proud of. And it became clear to us as we started to receive these applications and started hearing the stories from folks that this was something that was going to be necessary moving forward. I remember during one of the COVID Philanthropy Network calls last year, Sydney started talking about this idea of how in philanthropy we had this model of relief and recovery, but that it didn't really fit the situation. And I believe that we're still not in recovery. And as our colleague just spoke, that there's so many unanswered questions and so much uncertainty related to what things are going to look like on the other side of this, that I anticipate that there'll be a need for something like the relief fund, which we've now transitioned into the community care fund for at least the next 3 to 5 years. So we were already making preparations for implementing this next stage of the fund this year. And we're lucky to receive, again, additional sort of relief and recovery funding from the Mellon Foundation. We received support from William Penn and also from Fels, and the majority of that money is going towards the care fund. So we were able to commit at least $125,000 to the fund this year, and are hoping that we'll be able to at least continue it for 2022 as well. Melissa can give more specifics about the size of the grants and that sort of thing, and how much money has been distributed. So Melissa, you can take it away.
Thanks, Denise. I appreciate you up early with us giving these details about the Care Fund. Shira, if you could advance the slide, please, that would be great. So Denise gave sort of an overview. You know, we were trying to be as responsive as we could be last year. We saw a great need that needed to be filled, particularly for individual artists. There's a lot of focus on organizational relief funding during the pandemic, which is definitely necessary, undoubtedly. But Leeway's focus has always been on the individual creators behind art for social change. And so we really got to thinking, what can we do? We know we're a small funder, albeit mighty funder. Our budget, you know, what we give out in our grant making is usually between $260,000 and $300,000 a year directly to individuals. And so some folks might see that as a drop in the bucket, but if you know artists, you know that they can do a million amazing, impactful things with just $5, right? And so we thought, what can we do with the capacity that we have? Rolled this out in April, and knew that we couldn't do a public facing fund. We didn't have the staff capacity to do that, but we could focus on the portfolio and the ecosystem of Leeway grant and award recipients, which is about 1,500 folks since Leeway's inception in 1993. So we kept thinking, how can we take care of the Leeway family and these 1,500 artists for social change who are often on the margins as women, trans, and gender nonconforming folks. The Community Care Fund provided assistance and is still providing assistance of up to $1,000 for Leeway grant and award recipients with immediate needs around the finances that have been impacted from the pandemic. When we first rolled this out, we had 2 phases of it. One was sort of phase 1, and that covered losses that were from job layoffs or furloughs and lost income due to creative canceled events, work, and or creative opportunities. And we were asking sort of in the application for proof of cancellation, and that could have been anything from, you know, receipts, emails, MOUs, rental agreements, anything like that. And then we ran that for about 2 months and realized that asking for proof of cancellation was a barrier for some of our artists. And as the pandemic dragged on, that folks, the opportunities were drying up altogether. So it wasn't necessarily cancellations, it was that opportunities just didn't exist anymore. And so in phase 2, we expanded the fund to cover immediate needs, which included anyone in housing crisis, utility bills, rent or mortgage payments, medical cost, groceries and food insecurity, loan repayments, if folks needed help with childcare, elder care, PPE and other things, or anything else that we hadn't imagined that grantees might need assistance with. And that change directly came from listening to the folks who we serve, right? And what they needed in this moment. Sher, if you could progress to the next slide. So in terms of 2020, in that first phase from April to June 2020, we moved about $49,000 to 59 artists. This was about $1,000 each for each artist. Most folks came in at 1,000. Some folks, came in a little bit lower, depending on what they were requesting. But everyone who applied and was eligible received funding. We switched into phase 2 after listening to our grantees, and that included removing barriers to application. That's dropping the requirement for proof of losses. And it also included an option to apply via phone, because one of the things that we were seeing was sort of this technological barrier of who has access to online platforms and can do an application online versus who doesn't. And so Denise and I joke, but we literally activated a Leeway phone tree. And so we knew that if we could get in touch with, these 20 artists, that these 20 artists were going to call 10 artists each, and then this ecosystem and branch off would happen. It's one of the most beautiful pieces of the ways that our grantees support and help each other. And so don't be afraid of the phone. It's been really, really helpful. And our staff has been doing phone applications with folks, which have been really a beautiful experience and just a good touch base with folks. The other things that it included was we expanded the fund to include immediate needs in the second phase, and then we decreased it to $500, not because we thought folks didn't deserve 1,000, but we didn't have, we were trying to stretch those dollars and support as many grantees as possible. And as Denise referenced, we've received some really gracious support and are able to continue providing in 2021 $1,000 stipends. In total in 2020, we moved about $75,000 out to about 112 artists, and that is about an 18% increase in Leeway's entire annual funding. So that was a big push for us, but a worthwhile one to take care of our community. I just wanted to mention one of the reasons why this fund has been so successful is because transformative grant making can only happen when trust exists. And particularly for Leeway's community, our applicants' identities are oftentimes marginalized and inextricably linked to their work. And so asking for help can be really hard and challenging for anybody, but especially for folks who are not normally supported by institutions. And so one of the reasons folks were able to ask for help is because there is a track record and a history and a relationship between Leeway and our artist community. And so these sort of 6 bullet points here are, they're pulled from this 2018 report by Sterling Clark Foundation, the Headwaters Foundation, about trust-based philanthropy. And there's a lot of talk about trust-based philanthropy these days. And I think it's a worthwhile conversation, but it's also buzzworthy. And so how do we put action to the words that we're actually using in the philanthropic sector? And so these aren't rocket science, these 6 things, but it's really about providing unrestricted funding, making sure that we do our homework on the communities that we serve and actually have a relationship with them. Are we simplifying the applications that we're asking for? Are we asking for grant reports for these things? How are we listening and being responsive in terms of it? and actually providing support beyond the check. Again, not ground shaking stuff, but definitely worth mentioning for why this fund was so successful. Shira, if you could progress. Here's what 2021 looks like so far. On the right, you'll see sort of a breakdown of where the artistic disciplines that are being affected. And so we see, all the disciplines are being affected. I don't want to make any claims, but we see performance, visual arts, and multidisciplinary artists who often perform on stage being impacted deeply because the venues are closed. So far in 2020, we've moved about 31,000 to 34 artists, and that brings the total up to almost $107,000 for 146 artists since last April, which we're really proud about. Shira, next slide, please. These are just what our grantees had to say. I wanted to share today because it shows three things about what they're saying. It shows that there's some shame and guilt in asking for help. And so somebody said it was a moment to feel a part of a community and not helpless or ashamed for wanting help. And I think that's a really prevalent line that ran through our applicants applying for COVID funding. And this ability to say, no, this funding is actually for you. It's created to help you. And so please don't be shy or hesitant in applying for it. And it also talks about sort of the efficiency of the process. Next slide, please. And then, there's these conversations about whether or not relief funding should continue in 2021. For us, it was a no-brainer because we asked our grantees, literally, if they needed additional relief funding, and 92% of those folks indicated that they more than likely would in 2021. We also understood that the pandemic's impact is going to continue into 2021 and way beyond that likely. GPCA, the Greater Philadelphia Cultural Alliance, put out a report on the economic impact of COVID on the arts about a week or two ago, and they projected total revenue loss as $371 million from last March to this March. And so that loss is deafening. And they're looking at losses for arts nonprofits in our sector. And so if it's that deafening for the arts nonprofits, think about how deafening it is for the individual artists who are behind those organizations and serving them. We also found out that 41% of those orgs are unlikely to survive beyond fall 2021 on their current income streams. So it's just mind-blowing. Americans for the Arts found that 63% of artists are fully unemployed, with an average loss of $22,000 each. And I know these are facts and figures that we've been seeing, but it's worth lifting up, again, not just for the arts sector, but the power of grants for individuals. And then the third reason why we're continuing funding is we recognize the absence of funding for individual artists, both relief and otherwise, in our region, particularly for artists of color and artists who are creating work on the margins. Only 5% of pandemic response dollars in 2020 have gone to communities of color. And that is a statistic I think we need to sit really deeply with in terms of where this money is moving and how we're moving it, especially if BIPOC communities have double the death rate that white folks do as it relates to the pandemic. I'm not trying to be Debbie Downer this morning, but I think we need to really think about some hard conversations and what we have the capacity to do as funders, because we hold a lot of power and a lot of joy, and we have the power to shift change in our communities and support folks. Thank you.
Thank you both, Denise and Melissa, for this morning. There is one question about the geographic area that you cover. Can you speak to that?
Sure, yeah, we do cover the 6-county area, right? And that's Bucks, Montgomery, Delaware, Philly, Chester, and Camden. Barbara, you hit the nail on the head, my friend.
Great answer. Well, thank you again. Excellent. And we'll certainly, again, we'll look to possibly bring you back again and continue with the continued update, because you're right, this is not anywhere near over. Well, thank you much. And our next speaker, we have Reverend Danny Cortes, Esperanza, who will talk about the COVID-19 impact in the communities that they serve. Reverend Cortes.
Good morning, and you can hear me, correct? And I'm also curious if my background is backwards, as I'm told that it looks normal on your side, but it always looks backwards. My thumbs up, beautiful. As you can see, I'm Reverend Dan Cortes. I'm Executive Vice President and Chief of Staff at Esperanza. Esperanza is a community development corporation. We've been around about 35 years. We have always found ourselves situated in the heart of the Latino, the Hispanic community of Philadelphia, and Hunting Park at this point continues to be predominantly Hispanic, though the pressures of gentrification continue to push north. Our engagement with COVID is kind of interesting. You know, Esperanza has never seen itself as an organization that would be directly involved in health-related matters, right? Or at least in the clinical side of health-related matters. We understand by definition of the work we do that we will engage health in its broad definition, right? Talking about you know, physical environment, talking about the social determinant issues. So there are a couple of boxes of work that Esperanza, by virtue of what we do, touches on how people live, and by extension, what the nature of their quote unquote health is, right? So, and we have found in the world of COVID that traditional systems that speak to the question of the health of our community, the direct service and care of our people on the clinical side of things continues to be challenged. And I think COVID has exacerbated, right, has brought to the fore, has made more clear just how hard it is for traditional systems to access the communities, not unlike some of the conversations earlier that were had, to access the communities that are not often part of what we would call the mainstream. And you know, I laughed at the video in the beginning of Dr. Stanford and the Black Doctors, right? Which is a direct expression of just what needs to happen for communities of color and disenfranchised communities when traditional systems are incapable of being responsive to the needs of people of color. So for Esperanza, COVID is just one more expression of what we live daily. Right, it just brought to the fore the continued challenges that Hispanic people in the city of Philadelphia continue to experience across all the systems when it comes to access and equity. So what kinds of things have we found ourselves doing? I think it's important. Esperanza lives in a community that is has a high incidence of poverty. About 35% of our Latinos find themselves in poverty. We have an average income of about $24,000 a year. Between 50 and 16% of our neighborhoods are housing cost burdened. And, I can continue rolling those statistics out all morning. For those of you who are in the philanthropic world and read proposals from communities like ours, I would not be telling you anything you don't already know. But that's who we are, and that's where we find ourselves working. And for 35 years, that's kind of been our thing. Behind me is a picture of our campus. Esperanza currently has about 9 acres of real estate where we run all of our programs. We have a diversity of programs. We run K-14 educational systems. We got 2 charter schools representing about 2,200 children, K-12. We have a community, a 2-year associate's degree in liberal arts and applied sciences that we run in concert with Eastern University as a branch campus at Esperanza College of Eastern University, providing educational opportunities to about 400 Latinx individuals in our community. A program that offers us about 8 different degrees that are entryways into the workforce. We run workforce programs with the Esperanza Career Link, or the Career Link North, which is part of the city's Cyrillic system. We have about 60 employees that all they do is focus exclusively on trying to attach people to work, people who are underemployed, unemployed, dislocated, whatever the category would be. Most of all of those constituents come from either the African American or Latino community that's around our immediate footprint and into the Northeast, which is the area we're tagged to serve. We run immigration services. We run housing related services. We run youth programs. We run after school programs. We work with about 210 businesses on 3 different economic corridors that we work to help stabilize their business and attract business to the area by helping them with promotional issues, et cetera. And there are more things that we do. So when I said earlier that Esperanza touches on health, you understand that when you start thinking about what are the things that bear on a person's quote unquote health, we talked about it, housing, jobs, education, right? Those are the kinds of broad categories of work that ultimately the health systems have come to understand are essential and need to be addressed and responded to if people are going to have good health. Because if you don't have a job, you don't eat well, you got a bad house, you don't live well, those things are just kind of understood. So Esperanza's commitment to community is to create what we call a community of opportunity, a place where anybody would aspire to live, right? So when we defined our community as a place of opportunity, we understood that our mandate was to open gateways of opportunity in any way we can for the people that we have been called to serve. So whether you need a good education, we understand that that ramp is a better tomorrow. Right? So having a great K-14 system that allows a child to excel and to graduate from high school and end the college becomes an essential component to a community of opportunity. The same thing with a job, right? The same thing with a house. The same thing with small businesses that create a fabric in the barrio, right, that allows money to move among the people of the barrio, right, so that we can create the kind of economic stability that we need. So that's who we are as a general definition. So that's going to be my spiel on Esperanza.
Sure.
And I'm happy to talk to anyone more about that. And if you ever want to come out and check out our location, we'd love to give you a tour and show everything that we do. One of the things that I didn't mention was Christine is on here. She's going to be sending me texts telling me, you need to say this, you need to say that. But anyway, one of the things I didn't mention is as a part of that opportunity community, we created a theater, right? And we now have Esperanza Theater, which creates access to culture and the arts, right? Which is another way for a young person and or a community to have a sense of self, a self-expression, right? An ability to have what's the word they use now? Not equity. Self-actualization. There's all these new words that come out. Whenever I'm speaking, I forget them. So anyway, it's a place where people can have a sense of their own empowerment, right? Where they can express creativity and appreciation for who they are by the art that they are able to put on a stage and show and perform. So not only do we provide an outlet for our own art, whether it's Latin jazz, whether it's a drama that comes from Mexico or some other part of Latin America, right? It is also an opportunity to bring culture from downtown, uptown, and expose downtown to the realities of uptowns and vice versa. So we've brought the Philadelphia Orchestra has come, Philadanco has come, the ballet has come, the chamber has come. We bring all of that to the barrio and expose our children to ways that they and our community to other forms of artistic expression that both affirms our own, but it creates appreciation for other, and at the same time exposes other to the realities of the barrio. So those are the kinds of things that Esperanza understands to be this broad definition of opportunity. And then boom, here comes COVID. So Esperanza finds itself and I break COVID into 3 boxes of response, right? There's what I call the early period, the mid period, and the future period, so to speak, right? In the early period, which would be that through August, the reality of Esperanza was, how do we respond and react and move 500 people and $50 million of operational investment in a direction that continues to provide the services that the barrio needs, right? So much of our effort was focused on an internal repositioning of who we are in light of the crisis that presented. And we found ourselves moving 500 employees, schools, colleges, workforce programs, housing programs, youth programs, economic development efforts. All of that moved from the world of on the ground to the world of space and virtual, right? And all of the complexities and challenges of that. And for the world of COVID, what that meant was accessing computers, children getting desktops, college students figuring out how they can get access to Wi-Fi at home when they didn't have it, K-12 kids doing the same thing, figuring out how you reposition the delivery of social services, housing services, workforce services in ways that still delivers that to the barrio. And that was all consuming, as I think those of you who are in your own spaces had similar experiences, right? And we did pretty good with that. Even in the midst of COVID, we graduated 179 kids and created an outdoor stage where one child would come up and receive his or her diploma from one person, and then the family would be out in the audience, so to speak, in the garage or in the parking lot, and then they can come to the stage and have a family picture of just them, all of who had already been exposed to each other, creating responses to the reality of COVID, right? We continue to work with churches to provide educational information. A lot of our effort was finding ways to put literature in the hands of people and information in the hands of people that they could consume and understand how to engage this crisis, this dilemma. So we spent a lot of education on public efforts. Esperanza owns Impacto newspaper, right? Which is one of the Latinx newspapers in the city of Philadelphia. And that newspaper is distributed to about 15,000 homes directly. Between March and August of this year, we had 80-something articles, 48 articles, I gotta look at my notes here, 40-something articles that went out all about COVID, written in a way that communicates to our constituents, these are the things you gotta do, right? In the early days of COVID and continue to be a reality. So we found ourselves segueing activity, communicating aggressively to our constituent groups, right? The messages of COVID, and still running our programs. So that was the first stage of, then there was the second stage, which I talk about like September to what we in March, to just before March. What comes before March? April. No, that's the other direction. So anyway, in that window of time, Esperanza then spent a lot of time figuring out, now that we've kind of settled, how do we continue to drive the work? There was an election in place. Esperanza did not step away from voter engagement. Esperanza did not step away from communicating the need to get out the vote. We still went door to door and knocked on doors in the world of COVID to allow people to understand how essential it was to be vested in this particular, in all elections, but in particular this election, right? We registered, but we did text campaigns to 80-something thousand people 2 or 3 different times. You know, we went door to door in our neighborhood. We put literature out. So we did both voter registration, but then also get out the voter activity in significant ways in order to impact the election. So there was this entire effort on Esperanza's part to continue to do work. We worked really closely with the businesses. We did PPP related activity from the beginning of its putting out on the street, even until to this day. And we provided over support to some of our business to produce more than $400,000 of access to federal resources to underwrite small businesses. The resources we got from Philanthropy in order to support small businesses and or individual families. That's a lot of philanthropies that allowed us to redirect some of our resources to crisis relief. So we supported families who were hungry. We did about 3,000 boxes of food distribution in that second period of COVID, right? Where we helped families who were poor. We worked with our businesses and US Foods to identify restaurant workers who were some of the people who have been hardest hit, right? Which are significantly Latino, a stereotype that happens to be true, right? So we had to find a lot of ways to make it possible for these people to have some food, and we distributed more than 1,000 3,000 boxes of food to those families. We also found that the city of Philadelphia was extremely challenged, to be kind, when it came to responding to both testing of our people. So Esperanza spent a significant amount of time working with, guess who? The Black doctors. We understood partnership to be essential. So Dr. Stanford came to our site on 4 or 5 different occasions to do testing. We also did some testing with Jefferson Hospital, right? We found ways to bring others to the site in order to provide our people to access to the basic health services that should be available to them as standard fare in the traditional space, but to which the traditional space could not respond. So we did probably more than 3,000 what do you call it when they stick the thing up your nose? Testing, COVID testing in the early days. And just recently when Dr. Stanford was in Temple University, we worked with her to mobilize Latino constituents who have not had any neighborhood-based response to the COVID question to Temple University and moved people to them, being one of the primary drivers of Latino testing persons to the Temple experience. To date, we have registered more than 3,000 individuals to be tested and not tested to receive the COVID vaccine. So even to this day, we continue to be very involved in trying to find ways to help the city, right, which has really dropped the ball. I think currently there's about a 12% rate of Latinos receiving the virus, and I think the African American rate is like 13 or 14%, right? In a city that is 65% of color, right? You know, so it's a travesty to see how traditional systems have responded to the needs of its primary constituent in the city of Philadelphia, people of color, right? Which represents 65%, but when you do the math, it continues to be very low in the number of people of color who are being tested. So the Latino community saw that as a crisis. So in addition to all the work we've done to just continue to serve our own constituents within the definitions of what is our standard work for which we get funded, right? We have now had to take on the burden of the neighborhoods, right? When it comes to the stuff for which we do not get money, right? But which is essential for the long-term success and health of the barrio. We're talking about saving lives. So, you know, you need to reprioritize, right? When you're talking about something as simple as, do you know you got COVID, or do you need a vaccine to stay alive? Because, you know, it is still a significant number of people have died, but we've kind of gotten numb to the number. Right.
Reverend Cortes, we're at the top of the hour, so I want to make sure that take a minute just to see if there are any questions.
And that's fine. The final thing is we will be a FEMA site for the city of Philadelphia starting April 5th. We negotiated that with our state representatives, with our federal representatives, and with the city of Philadelphia. And hopefully April 5th, Esperanza will be a FEMA site where you can get up to 1,500 vaccinations a day. Our commitment continues.
Thank you, sir. Any questions before we close out our session today? Great. Any for those who remain on the line, we'll take at least a minute for open share if you have things that you'd like to share for the group. Excellent. I just want to make sure I'm mindful of everyone's time. So to all of our speakers, we truly, truly appreciate you coming to share. This is what, you know, exactly what we need to hear from all points and all parts, all neighborhoods and communities across the region. And, you know, as we've said many times during the session this morning, we're nowhere near through this thing, and so sure there'll be time, an opportunity to bring you back again to check in as well. Certainly we'll send your information out to all of those who register for the call, and this particular session since it is being recorded, will also be made available for those who did not attend as well. So thank you all for your time this morning. Truly appreciate it, and have a wonderful March 31st, the last
Thanks,
day of the
Sydney.
quarter. Take
Thank
care.
you.
Thank you.
Take care, everyone.